Oh, there he is.
Oh, yes, our dear friend.
I don't want to stand in front of that.
Okay, good morning, everybody. Thanks for joining us here. Now, over the coming days, weeks, and months, health insurance companies are going to begin requesting rate increases, many of them very large, in states across the country. We saw the beginning of it over the last few days with both Virginia and Maryland requesting huge rate increases that are going to empty out the wallets of far too many families. If these early states are any indication, health insurance companies are going to ask for huge hikes in the wake of President Trump and congressional Republicans' repeated efforts to sabotage our health care system. And we Democrats are going to be relentless in making sure the American people exactly understand who is to blame for the rates. The Republicans control the House, the Senate, the presidency. When the rates go up, especially after all their actions, it's on their back, and they know it. Since President Trump took office, Republicans have worked day in and day out to systematically dismantle our health care system. Despite the promises President Trump made on the campaign trail, remember what Trump said? Quote, he's going to, quote, take care of everybody and deliver health care that is far less expensive and far better. Once again, Trump is not delivering on what he promised on health care, as on so many issues. Clearly, their efforts were a ruse to put the insurance companies back in charge and force Americans to pay more for less when it comes to health care. Once again, in keeping with the theme of putting corporations and special interests above the well-being of American people, the Republicans have repeatedly sabotaged the health care system, putting the burden on average families. As our new report today outlines, and as my colleagues will explain, while Democrats and the American people succeeded in stopping their dangerous Trump care bill from passing the Senate, it hasn't stopped the administration from taking damaging steps to dramatically change and undermine health care in our country, raising the costs on millions of American families and reducing the quality of coverage. Over the next few months, states will announce proposed health care insurance premium rates for 2019 and make decisions on where they want to offer insurance. And when those rates go up and coverage goes down, it's important to remember that President Trump and congressional Republicans are fully responsible for the significantly higher premiums and millions fewer people insured. We've already seen the proposed rate increases in Maryland and Virginia, and let me be clear, these increases in health care costs for families are a symptom of Republican sabotage. They didn't happen on their own. They wouldn't have happened. The insurers themselves have said it, if not for Republican sabotage. It was not ACA making these premiums go up. It was rather Republican efforts to do so. Secretary Price has said it well. He laid out the naked truth about the Republican scam for the rich. Here's what he said. Harm the pool in the exchange market because you'll likely have individuals who are younger and healthier not participating in that market, and consequently that drives up the cost for other folks in that market. That's the architect of this stuff. President Trump's accomplice, who he later had to fire for ethical reasons. That's what he said, not us. That's him. He wants to correct the record. No. Secretary Price said, quote, he believes that repealing the individual mandate will harm the pool in the exchange market. That's not Chuck Schumer, Ron Wyden, or Patty Murray talking. It's a Republican congressman, a Republican-appointed HHS secretary. Or how about Chet Burrell? He's the president and CEO of Care First, when they requested substantially higher rates in Maryland and Virginia. He said, quote, there's been a series of actions taken by the current administration that have undermined enrollment. So I'll close with this. President Trump and the Republicans promised America a cheaper, better health care system. The simple truth, President Trump has not delivered. In fact, he's made things worse. President Trump talked and talked and talked as he ran, and since he became president, about making health care better and cheaper, but in every aspect he's failed to deliver. In every respect, he's made health care worse and more expensive. Simply put, President Trump has dropped the ball on health care, and the American people know it. Senator Murray.
Well, thank you so much, Senator Schumer. Again and again over the last year, President Trump and Republicans in Congress tried to jam through their terrible Trump Care bill through Congress, and people across this country stood up and they said no. And they said no because Trump Care would raise costs for patients and families. It would take coverage away from millions of people, and it would undermine care for people with pre-existing conditions and remove protections against insurance companies who deny coverage for maternity, mental illness, substance use disorders, and other essential care for their families. So families rejected Trump Care time after time after time. But President Trump and Republican members in Congress didn't listen. In fact, because he couldn't force Trump Care through Congress, President Trump decided to create it from the Oval Office by sabotaging families' health care in every way that he could. He created confusion and uncertainty about the future of health care in our country and said the best thing we can let it do is explode. That's what he said. He intentionally made it harder for people to get covered by making open enrollment windows shorter and slashing investments in telling people about their coverage options. He's put forward a rule allowing insurance companies to sell these junk plans that only raise costs or even deny coverage altogether for people with pre-existing conditions and leaves families with huge medical bills when they need basic care. One report even showed one of these junk plans denies hospital coverage on weekends. And Republicans in Congress didn't just sit by and watch this happen. They helped. They helped by passing a tax bill that President Trump's own former Secretary of Health admitted right here it would raise premiums. Unfortunately, all of this sabotage has had a real impact, and the rates going up are beginning to make that clear. And it's especially frustrating because it did not have to be this way. Just months ago, Republicans and Democrats had a bipartisan agreement. It would have lowered premiums and stabilized healthcare markets. But instead of even giving our bipartisan bill a vote, Republican leaders opted to retreat to their partisan corner, prove to their big donors just how much they hate Obamacare, and blocked bipartisan legislation that could have lowered families' premiums. So, my message to Trump and Republicans today is, patients and families deserve better than the higher costs and dysfunction they are getting under Trump Care by sabotage. And as soon as Republicans are ready to work again in a bipartisan way and act actually to lower families' costs, Democrats will be at the table. We are ready for Republicans to join us. There is no good reason to wait, and that's what we are pushing for. So thank you very much, and let me turn it over to Senator Wyden.
Thank you, Senator Murray. It's good to be with the leader and my Pacific Northwest colleague, Senator Murray. And let me pick up on where they have eloquently left off. Republicans promised for years and years that they were going to repeal and replace the Affordable Care Act. Then they got the Senate, the House, the White House. Their dog caught the car. And after their dog caught the car, they couldn't get it done because the American people couldn't stomach what it was they were offering. So now you've got the Trump administration and their allies in Congress still trying to settle the political score and appease the special interests by undermining health care markets. And as my colleagues have said, that's going to spell higher premiums for American families. And the early news is indicating it could look like double digits. Now, I'd sum this up by way of saying that the Republicans are trying to create Trump care through executive decree. And Exhibit A, as Senator Murray touched on, are these junk insurance plans. Let me tell you, folks, this stuff often is going to be worth little more than the paper it's written on. It reminds me of my days with the Gray Panthers when fast-talking agents would sell seniors 10, 15, 20 policies. And it was just junk. It's really the stuff of yesteryear, going back to the days when the insurance companies could clobber people who had a pre-existing condition. The Trump administration is still finalizing the rule. The Kaiser folks have already done a survey of currently available short-term plans. None of them cover a pre-existing condition. None of them cover maternity care, and only a handful cover prescription medicine. So these plans may sound cheaper on paper, but the real bill's going to come under Trump care when your insurance company denies you treatment because your policy doesn't cover what most people think are the conditions that health insurance ought to cover. Last point with respect to junk insurance is at the end of last year, Idaho was the first out of the gate to try to get insurance companies free rein to discriminate. Let me tell you what the Trump administration is up to. They're sort of winking and nodding at them, telling them it'll be pretty much okay to discriminate. Just don't be too obvious about it. And the fact is there are going to be a bunch of other states coming in with just the same kind of approach. And I think the three of us think that health care is a right, and Republicans seem to believe people ought to have a right to a bunch of junk insurance not worth the paper it's written on. One last note that a lot of you asked about, and I appreciated the leader's comments on CHIP yesterday. The reports indicate that the majority of the president's rescission package would come from CHIP. This ought to infuriate any American who watched the congressional Republicans use CHIP as a political prop last year to once again play games with this program that is a lifeline, and it was being used as a political prop to satisfy the most extreme wing of their party. It is a proven bipartisan program that offers affordable health care to millions at low cost. And to target a program that gives affordable health care to 9 million kids while simultaneously creating chaos, uncertainty, and higher premiums in the individual market is doubly dangerous and cruel. Thank you, Mr. Leader, Senator Murray, and give them all the hard questions.
Yeah. I am only going to take questions on this subject because I have to leave, but I will be answering questions at the stakeout. I imagine some of you have a few other subjects you want to ask questions on. This subject.
Well, Senator Wyden just raised CHIP, and you put
I'll
out
let
a
him.
statement on CHIP
Yes.
yesterday that said Trump is looking to tear apart CHIP, hurt middle-class families and low-income children. So, but you guys all voted for cuts to CHIP just a few weeks ago as part of the omnibus when you were using it for other purposes. So why aren't you doing the same thing?
Well, we came to an agreement on the omnibus, and it had a lot of good things in it. This is just a cut of CHIP. He's not putting the money into good things. He's just cutting. Yes.
But the administration says that the authority for those funds that they're rescinding has expired. So
What past administrations have done is when that happens, they use it for other things, for good things, or put it back in CHIP. They could ask us to put it back. They're just taking money away from kids who need health care. Did you want to say something? I'm going to go. I'm going to let them take over. Thank you.
Let me give you a sense of actually how this is going to put at risk our kids. The states can draw on some of these dollars in the event of an emergency, like a natural disaster when kids need reliable health care fast. What we're concerned about is the Trump rescission plan will slash the funding for this backstop and leaves CHIP programs in each state, in effect, with one hand tied behind their back, and will once again throw these families into a kind of sea of uncertainty. And these families, so many of them, are walking on an economic tightrope. And often they go back and forth between Medicaid and CHIP, depending on whether a spouse is working or what their salaries are and that sort of thing. And by our calculations, this plan will slash the funding for this critical backstop and will really harm CHIP programs across the country by, in effect, tying one hand behind their back.
All right, Chuck left, so we're good here. Thank you all very much. Appreciate it.
Thanks, everybody. For anybody who wants to talk.